We've had a fairly extensive experience with TOPS, and the reason for that is that we were involved in the original TOPS study, which was actually over 10 years ago. And so we're looking at having patients who are involved in that initial study who still follow up with us, who have 10-year follow-up. That's very rare for an investigational device. Typically speaking, you're looking at 2 or 3 year follow-up, or at most when you're talking to patients about your experience with this device. So we have a good experience that involved 30 to 40 patients who were involved in the initial TOPS study, and we've continued to follow them out for, like I said, up to 10 years.
My experience with the TOPS device has been excellent. I was involved with the first IDE. We had 4 patients that received the TOPS device and 4 patients that were randomized to a fusion, posterolateral fusion instrumentation, T-lift procedure. All patients came back for follow-up. We have long-term follow-up on all of them. There was no failures in either group. There was no reoperations in either group. The patients who received the TOPS device have not required any revisions for loosening of the instrumentation or breakage of the instrumentation, and no significant issues of adjacent level changes. Similarly, in the fusion group, we have seen some adjacent level changes and some adjacent spinal stenosis, but none to the extent that they've required more surgery. So both operations worked very well. That motion is good for the spine. Motion preservation is where things are moving. We don't fuse joints anymore, so we should try to avoid fusing the spine if we can, because motion is good.